Okay, if you see this cholinergic system, the main important neurotransmitter is the acetylcholine. Okay, see now we'll see how this neurotransmitter is going to be synthesized and where it is stored and how this neurotransmitter is going to be released, right? See first, if you see inside our body, we are having the ATP molecules. Okay, see this ATP in the presence of acetate along with coenzyme A, clear, see in the presence of acetate activating reaction, okay, that is acetate activating reaction. Here you are producing acetyl coenzyme A. Okay, see this acetyl coenzyme A in the presence of choline and in the presence of choline acetyl transferase. Okay, finally, you are producing our neurotransmitter, that is acetylcholine. Clear? And the coenzyme A is going to be released. Okay, see this is how the acetylcholine is going to be synthesized inside our body. See that is okay, ATP along with the acetate molecules and the coenzyme A by acetate activating reaction. Initially you are producing the acetyl coenzyme A. Okay, see this acetyl coenzyme A in the presence of choline molecules and with the help of one enzyme, that is choline acetyl transferase, we are producing our neurotransmitter, that is acetylcholine, right? See this acetylcholine, once it is synthesized, it is stored in case of synaptic vesicles. Okay, see where this neurotransmitter is going to be stored in case of synaptic vesicles. I hope you know where these synaptic vesicles will be present. Clear? See, I hope right you know what is meant by a synapse. Clear? Suppose if it is a one neuron and if you see this is another neuron, in between the space you will call it as a synapse, right? See where you are having some vesicles, these vesicles you will call it as a synaptic vesicles, right? See in these vesicles mainly this acetylcholine is going to be stored. See whenever there is any requirement of this acetylcholine, immediately that acetylcholine is going to be released. Clear? See generally see some drugs which can blocks the actions here. See, suppose if you see one drug, you will call it as hemicolinium. Okay, if you see this hemicolinium, okay, see this can block the uptake of these choline molecules. Clear? See, suppose if you see this hemicolinium, if it blocks this uptake of choline, means obviously the synthesis of acetylcholine is going to be decreased. Clear? See, and next one is the active transport of this acetylcholine into these synaptic vesicles. Okay, see that is going to be affected with the help of okay, one transporter that is known as VAT. Okay, see this VAT will call it as vesicle associated transporter. Okay, see once there is a synthesis of this acetylcholine, that has to be transported into these synaptic vesicles. Okay, see that transportation is going to be affected by this VAT. Why? Because which is mainly blocked by one molecule, we will call it as vesamicol. Okay, this is blocked by vesamicol. Clear? See, next one is the release. Okay, the release of this acetylcholine is going to be inhibited mainly by one toxin. You will call it as botulinum toxin. Okay, with the help of this toxin, the release can also be inhibited. Okay, see this about the synthesis, storage, and the release of this acetylcholine molecule, right? I hope you understood. Next, we'll see about what are the different receptors that are present in case of this cholinergic system. Okay, next we'll see what are the different types of receptors that are present in case of this cholinergic system. See, mainly we are having two types of receptors here. Okay, the first one is we are having muscarinic receptors. Next, we are having nicotinic receptors. Okay, these are the two kinds of receptors that are present in case of this cholinergic system. Okay, these muscarinic receptors, we will call it as G protein coupled receptors, and these nicotinic receptors, if you see, these are the ligand gated ion channels. Okay, see muscarinic, you are having M1, M2 and M3 type of muscarinic receptors, and nicotinic you are having NN and NM type of nicotinic receptors. Clear? So we'll see the location and the functions of these receptors now. Clear? See, first we'll discuss about the muscarinic receptors, that is the three different types of muscarinic receptors, that is M1, M2 and M3. Okay, first we'll see about M1. See, this M1 mainly present in case of autonomic ganglia. Clear? See, whenever the acetylcholine binds to the M1 receptors of these autonomic ganglia, which may leads to depolarization and which can also causes the release of histamine. Okay, the histamine is going to be released whenever the acetylcholine binds to the M1 receptors of the autonomic ganglia. The next one is this M1, which also be present in case of gastric glands, so that which may leads to acid secretions. Okay, see, next one is this M1 also present in case of CNS, which may useful for learning, okay, memory, and also for motor functions. See this about the M1 receptors. Okay, and next we'll see about the M2 receptors. See, this M2 mainly present in case of SCA node, present in AV node, okay, atrium, present in ventricles, and in case of cholinergic nerve endings, and it also present in case of CNS. Okay, these are all the locations of this M2. Okay, where it will be present in SC node, AV node, atrium, ventricles, cholinergic nerve endings, and the CNS. Clear? See, because as it is present in the SCA node, which will be causing hyperpolarization and decreases the rate of impulse generation. Okay, it is going to be decreasing the rate of impulse generation. And regarding the AV node, it is decreasing the velocity of conduction. And in case of atria and ventricles, which is going to be decreasing the contractility. Clear? And in case of cholinergic nerve endings, which is decreases the acetylcholine release, and CNS, which will be causing like tremors, analgesia. And next one is, okay, see this also present in case of smooth muscles, okay, visceral smooth muscles, okay, which may leads to contractions of these visceral smooth muscles. Okay, see this about the location of M1 and M2 and regarding their functions. Okay, See, M1 is present in case of autonomic ganglia, gastric glands, and in case of central nervous system. And M2, okay, these kind of receptors will be present in case of SA node, AV node, atrium and ventricles, cholinergic nerve endings, central nervous system, as well as in case of visceral smooth muscles. Okay, see, next we'll see about the M3 receptors, okay, where it will present. If you see this M3, this also present in case of visceral smooth muscles. Okay, this also leads to contractions of these visceral smooth muscles. Okay, and it also present in case of iris, that is in case of eyes, which will be useful for the constriction of pupil. Okay, next one is it is also present in case of ciliary muscles. This will be useful for the contractions of these ciliary muscles. Next, in case of exocrine glands, causes the secretions from these exocrine glands. It is also present in case of vascular endothelium, which is causing the release of nitric oxide, which leads to vasodilation. Okay, so this is about the M3 receptors. Okay, M3 mainly present in case of smooth muscles, iris of the eye, ciliary muscles, exocrine glands, and the vascular endothelium. Okay, see, these are all the functions of these okay, different organs by which whenever the acetylcholine binds to this kind of M3 receptors. Okay, next we'll see about the nicotinic receptors. First, if you see an N, okay, N indicates neuron. Okay, see, this will be present in case of autonomic ganglia. Clear, see, which is causing depolarization. Next one is it's present in case of adrenal medulla, which is because of that causing catecholamine release, and present in case of CNS, which is causing site specific excitation or inhibition. Okay, see, this is about NN. Next one is NM. Okay, mainly present in case of neuromuscular junctions, which is causing depolarization of muscle and plate. Clear, because of that causing contractions of skeletal muscle. Okay, see, this is about the nicotinic receptors as well as the muscarinic receptors, okay, that are present in case of this cholinergic system. Okay, next we'll see about the cholinergic drugs. Okay, what are the drugs that are acting on this cholinergic system? Okay, that we'll see. You will call it as cholinergic drugs, or you will call it as cholinomimetics, or you will also call it as parasympathomimetics. Okay, what are the drug different names? That is cholinergic drugs, or you will call it as cholinomimetics, or you will also call it as parasympathomimetics. Okay, see, these are the different names. We are having two category of drugs in case of these cholinergic drugs. See, that is you are having choline esters. Okay, examples like acetylcholine. You are having methacholine. Next, carbachol. We are having bethanicol. Okay, see, these are all the choline esters. Okay, acetylcholine, methacholine, carbachol, and bethanicol. Next, we are having some alkaloids. Okay, the alkaloids like muscarine. Next one is pilocarpine. Next one is aricoline. See, these are the alkaloids. Okay, see, these are some drugs which is acting as a cholinergic drugs. Okay, choline esters and the alkaloids. Okay, see here about these cholinergic drugs, we are discussing this acetylcholine as a prototype. Clear? We'll discuss all about this acetylcholine. See, first we'll see about the pharmacological actions of this acetylcholine. Okay, first we'll see about muscarinic actions. Okay, first one is regarding the heart. See, I already told you heart is having okay, one kind of receptors, muscarinic receptors, that is M2 type of muscarinic receptors mainly present in case of heart, right? See, I told you which is present in case of SCA node, okay, which is causing hyperpolarization. Okay, so which is going to be decreasing the rate of diastolic depolarization. Because of that, which is going to be decreasing the impulse generation. See, whenever there is a decreased impulse generation, which may leads to bradycardia, and sometimes which may leads to cardiac arrest. Okay, next one is it is present in case of AV node also, right? It is decreasing the velocity of conduction, and it is also present in case of atria, present in case of ventricles. Both it is going to be decreasing the contractility, right? So this is about regarding the heart. See, if you have learned perfectly regarding the receptors, their locations and the functions, and so that you can easily write the pharmacological actions of these cholinergic drugs. Okay, see why? Because these kind of drugs which is mimics the actions of the acetylcholine, right? So this is regarding the pharmacological actions about the heart. Next we'll see about the blood vessels. See, specifically, if you see these blood vessels are going to be dilated, right? See, because of that, decreasing the blood pressure, and which may leads to flushing. Okay, this flushing means the redness of the skin. You will call it as a flushing. Clear? Suppose if you see M3, okay, M3 muscarinic M3 type of receptors will be present in case of vascular endothelial cells, right? See here, it is also causing vasodilation, that is mainly through the endothelium dependent relaxing factor. Okay, endothelial dependent relaxing factor. See, because of this, which is releasing the nitric oxide, so which is causing this vasodilation. But here, if you see the dilation of the blood vessels, which is a direct effect through the M2 muscarinic receptors. But if with the involvement of these M3 receptors, also the blood vessels are going to be dilated. See, not because of direct effect, but through this endothelial dependent relaxing factor. Okay, this factor is going to be releasing the nitric oxide, so that you may observe this kind of vasodilation whenever there is an involvement of these M3 receptors. Clear? Suppose if there is an involvement of M2 receptors, there will be direct dilation of the blood vessels you may observe. But whenever there is an involvement of M3 muscarinic receptors, no doubt there will be a vasodilation of the blood vessels, but through this endothelial dependent relaxing factor. This factor is going to be releasing the nitric oxide, which may causes this vasodilation. Clear? See, and one more thing is in case of males, okay, this penis is having the cholinergic nerves. Okay, see, these cholinergic nerves are going to be stimulated to this penis, so that which will be causing the erection of this penis, that is mainly by the release of this nitric oxide. Okay, you have to remember this thing also. Okay, this organ having this cholinergic nerve innervations. Okay, see, in this organ, okay, whenever the blood vessels are going to be dilated, then you may observe the erection of this penis. Okay, the mechanism behind this erection is because of this release of this nitric oxide from this endothelial dependent relaxing factor. See, that means whenever the acetylcholine come and binds to these M3 muscarinic receptors, immediately this is going to be stimulated, which will be causing the dilation of blood vessels in this penis, causing the erection of this penis. Okay, see, and next we'll see about the smooth muscles. Okay, next about the smooth muscles. If you see the smooth muscles are contracted mainly through the M3 receptors. Okay, and next one is the tone and peristalsis. In case of GIT is going to be increased, and mainly if you see the sphincters, okay, the sphincters are going to relax. See, because of that, which may leads to abdominal cramps. Okay, there is a difference between abdominal cramps and pains. Clear? See here, because these sphincters are going to be relaxed because of this acetylcholine, see, which may leads to these abdominal cramps. Okay, and peristalsis in case of ureters. Okay, that is going to be increased. Here, in case of urinary bladder, we are having different types of muscles. See, like detrusor muscles. Okay, see, these kind of muscles undergoes contractions, and some muscles like bladder trigone and sphincters. Okay, see, these kind of muscles undergo relaxation. Clear? See, next one is bronchial smooth muscles. In case of bronchi, these smooth muscles undergo contraction. See, because of that, there is a chance of precipitation of asthma. Okay, see, this is all about the smooth muscles. Clear? Smooth muscles generally contracted through the M3 muscarinic receptors. The tone and peristalsis of the GI tract is going to be increased. Okay, and the sphincters undergo relaxation, which may leads to the abdominal cramps. Okay, the peristalsis of ureters is going to be increased. Next, detrusal muscles undergo contraction. And next one is in case of bladder trigone and sphincters undergoes relaxation. And next, coming to the bronchial smooth muscles, which undergoes contractions, so that it is going to be precipitates the asthma. So better this acetylcholine is going to be contraindicated in case of asthma. Okay, next one is related to the glands. Okay, see, the secretions or all the secretions are going to be increased mainly by these M3 muscarinic receptors. And next one is, suppose if these M2 receptors that are also present in case of some glands, so which may leads to sweating. Clear. And next one is salivation. See, sometimes the sweating is going to be increased. Okay, the salivation is going to be increased. Okay, lacrimation is going to be increased. See, that's all because of this kind of, okay, acetylcholine that binds to this kind of muscarinic receptors. Okay, and next one is related to the eyes. If you see, okay, contractions of the circular muscles of the iris. If you see, regarding the circular muscles of iris undergoes the contractions which is causing miosis. Okay, this is the constriction of the pupil. Next one is contractions of ciliary muscles. Suppose if there is any contractions of the ciliary muscles, which is going to be decreases the intraocular tensions. Clear. See, in both these cases you are going to be observed the contractions of the circular muscles of the iris leads to the miosis, and the contractions of the ciliary muscles of the eye which causes decrease in intraocular tensions. Okay, this is all about the muscarinic actions. Next we'll see about the nicotinic actions. Okay, first about the autonomic ganglia. See here, the sympathetic and the parasympathetic ganglia both are going to be stimulated only in case of higher doses. Okay, you remember both the sympathetic and the parasympathetic ganglia are going to be stimulated in case of higher doses. Clear. See, suppose if you are giving the higher doses of this acetylcholine after atropine, so which may leads to tachycardia, it is going to be increases the blood pressure. See, that is mainly due to sympathetic ganglia stimulation. Clear. See, this is about the autonomic ganglia. You remember both the sympathetic and parasympathetic ganglia are going to be stimulated in case of the higher doses. Okay, see, whenever if you are giving these higher doses of acetylcholine after the atropine, which may leads to the tachycardia and increased blood pressure, see, that is due to the sympathetic ganglionic stimulation. Okay, next if you see regarding the skeletal muscles. Okay, first one is autonomic ganglia, next one is skeletal muscles undergoes contractions. See, whenever if you are giving intra-arterial injections, that is in high doses, see, which may lead to twitching and fasciculations. Okay, see, this is about the nicotinic actions. Next, we'll see the actions regarding the CNS. See, generally, if you are giving this acetylcholine through the IV route, okay, which cannot cross the blood-brain barrier, so you may not observe any kind of okay, CNS effects. But if you are giving the direct injection to the brain, you may observe that is arousal response, okay, which is followed by depression. Okay, see, these are all regarding the pharmacological actions of this acetylcholine. Next, we'll see about some interactions, drug interactions regarding this acetylcholine. Okay, suppose if you are giving this acetylcholine along with okay, acetylcholine with some drugs, okay, that is anti-choline esterase. Okay, it is going to be increasing the acetylcholine levels. Okay, see, whenever if you are giving the combination of this acetylcholine along with the anticholine esterases, it is going to be increasing the acetylcholine levels. And suppose if you are giving atropine, okay, along with this acetylcholine, it is going to be inhibits the actions of the acetylcholine. choline. Okay, see, these are two main interactions you may observe regarding this acetylcholine and some adverse effects. If you see, okay, previously we had seen in case of pharmacological actions, you may observe like bradycardia. Okay, there will be decreased blood pressure. I told you, you may observe the flushing. Okay, and sometimes the abdominal cramps. Okay, that is, and next one is twitchings and fasciculations. See, these are all some adverse effects you may observe. And contraindications, you remember I told you which is contraindicated in case of the asthma. Okay, next we'll see about uses. Okay, see where we are going to use these kind of acetylcholine. See, nowadays we are not using this kind of acetylcholine. See, mainly because of its variable and non-selective action. Okay, because of its variable and non-selective action. See, nowadays we are not using this kind of acetylcholine, but to induce meiosis, okay, of the iris. See, definitely to induce meiosis of the iris after delivery of lens. Okay, after the delivery of lens in cataract surgery. Clear. See, during this cataract surgery, there will be a delivery of this lens, right? See, after the delivery of lens in cataract surgery, okay, to induce the meiosis of the iris, definitely we have to use this acetylcholine. Okay, see, that's all, students, about this okay, acetylcholine.